Hello. Hi, it's Friday and it's a wonderful day to talk about pelvic floor. Pelvic floor and vaginas and everything down there. It's been my theme, my plan all month to share with you some really valuable information as active women, things that we can do to keep everything down there functioning happily so we can feel confident and ready to do our active living and our sports and just our general daily lives. So I'm so excited today to have a wonderful chat with my friend Angelique. Angelique Montano-Bresolin. Double hyphen, those longer names, I always have to make sure I always get them right. And I'm going to invite her to come join us because I am excited to chat together. Should be joining me hopefully any second now. There we go with Angelique. There she is. Here she comes. Hello.
Hi, Andrea.
Hi.
Good to see you.
Yeah, I'm so excited. You and I have been chatting, for a few months now, and I was like, I really need to get Angelique in talking to my people, talking to my active women, talking to my female athletes, because as an active woman in my 40s, this is, it doesn't matter how old I am. Like, I just find like this idea of pelvic floor physiotherapy, right? This pelvic floor, I should say, like this focus of pelvic floor from a muscular perspective, I find so interesting and something I've been talking so much to people now. And then being in your world and learning so much more about some of these aspects around the muscle part, but also much more beyond the muscular aspect. So just for anyone joining us, I want people to know that, Angelique is a registered physiotherapist with a specialty practice in pelvic floor. And you've been doing this for over 20 years. You look awesome, by the way. I think we both do. And I was just, when we were chatting earlier, you said to me that in 2012, you founded your clinic, Proactive Pelvic Health Center in Toronto, which at the time in 2020 was the first private multidisciplinary clinic in Toronto with this kind of pelvic floor rehab focus. Like,
yeah.
Really?
In 2012.
Sorry. That's right.
Yeah.
That's what I meant. I didn't say that. But like 2012, like that was not very long ago.
So, I mean, we're talking still like 10 years ago. I mean, there were pelvic physios practicing in Toronto, a handful of us probably at the time. And yeah, I got into pelvic health around 2009, 2010. And at that point, it was really tough to find a pelvic physio. But I mean, the field is growing so much. And that's really what drove me to open Proactive Pelvic Health in 2012, because there was just such a big need. And, women's health just generally was so underserviced. So it was really my mission to get a group of individuals together that understood pelvic health rehab and how best to approach pelvic floor problems like leakage and pain, anything to do with pregnancy and postnatal care, because there's so many layers and so many factors that need to be addressed when it comes to our pelvic health. Sure, I mean, our physical, like our musculoskeletal, part of our body is a huge part when it comes to physio. But, being able to work with other colleagues on the team, like osteopaths, psychotherapists or sex therapists, even orthopedic physios, and just really tag teaming and naturopaths, tag teaming and being able to get our clients like the best outcomes is really my focus. And so that's what's brought Proactive Pelvic Health to life.
I love it. And I know you recently opened a digital boutique as well, which I'm also super excited to talk about. But I do want to share with everyone tuning in some of your brilliant expertise of being such an expert in this world of pelvic floor. And I just keep saying I'm just so excited, because I will say this week I've had some follow-ups with some of my patients to whom I've referred to pelvic floor specialists such as yourself. And they're coming back to me saying, like, Andrea, like, you've changed my life. Like, referring me to someone who can thoroughly assess pelvic floor function, which of course, as you know, right, goes beyond like the pelvic floor, but like glutes, hamstrings, low back, abs,
Yeah.
and especially my active women, right? Like,
Yeah.
I'm just on a high this week. So I had so many patients say to me this week, like, it has changed my life in terms of pain, but also in terms of like comfort of a tampon and sexual health and enjoyment. So I'm just yeah, I'll try to contain myself today.
And you know what? I love speaking to this population specifically because I mean, I was really into sports when I was in high school and university too. I was a varsity athlete, played volleyball for Western University here in Ontario for 4 years in my undergrad, and really didn't know anything about pelvic health at the time. Although after getting into this, then discovered, oh my gosh, that's why I struggled with this and this and this. And so, you know, as active women and individuals that are really into sport and exercise, you know, oftentimes we pride ourselves on our health, but sometimes we don't really know what's going on like below the surface, so to speak, until we just educate ourselves more about it. And then we start to discover, wow, okay, maybe that explains why I have to pee so much, or that explains why I'm constipated, or that explains why I have pain with sex, right? So yeah, it's a very common thing too in active women. So I'm really happy to be here to talk about it more.
Yeah, I came across that like speak. So I was a varsity athlete as well in university. We were rival schools. Although I'm not a volleyball player, I was at track and field.
Okay.
And despite my height, I was a pole vaulter primarily.
Nice.
Yes, it's a whole other wonderful story to tell. But I think what's interesting as I'm delving more into me learning more about pelvic floor health is that almost 30% of college age or university age women have some symptoms of pelvic floor dysfunction. Like almost 30%.
Yeah.
And I was fortunate back then not to, and possibly because as a pole vaulter, yeah, there's a lot of running, but the landing was on a cushioned surface.
Yeah.
So maybe that protected me a little bit from the tension and the strain. But then later on, I've moved into ultimate frisbee, and there's what are called layouts or dives, like full Superman dives to catch a frisbee, and right, you kind of land like, and on more than one occasion have I turned to teammates and like, hey, can you, as I walk away, can you just take a look down there? Because I feel like there was leakage.
Yeah.
But it's also sweaty because it's a hot summer sport. So sometimes the sensory aspect, you're not sure.
Yeah.
And open my eyes to like, yeah, but I'm a healthy, active woman of a healthy weight. I exercise regularly. I eat well. Obviously, I'm a naturopath. And like I had never given birth to a child.
Yeah.
So in my mind, I was like, well, pelvic floor work is for people who've, you know, carried children to term or almost, or I'm sure you'll correct me on some of my language there, but to me it was like the pregnant people. And I was like, okay. And then, talking to one of your colleagues opened my eyes, and I was like, okay, we'll go have someone assess. And
it's super common, like super common. 1 in 3 will have some sort of pelvic floor dysfunction. And you know, what does pelvic floor dysfunction mean? I mean, it's kind of like an umbrella term, right? Pelvic floor dysfunction can include things like bladder leakage. It can include things like bowel leakage, not being able to control your gas, issues with pain. So pelvic pain, lower abdominal pain, pain with penetration. So whether it be intercourse or, you know, medical exams or tampon insertion, like you mentioned, there's all sorts of different pelvic floor dysfunction concerns. And I'd say with active women, especially, stress incontinence is a huge one. So for those that don't know what stress incontinence is, stress incontinence is leakage of urine when you have an increase in pressure or load on your body, right? So you're talking about pole vaulting, and you know there's like some high impact sort of activity involved there, where you know, you're hopping or you're jumping or you're landing really quick, really hard. You do have the cushion.
In my world, yes.
Yeah.
But as an ultimate frisbee player, there's no cushion, and often
Yeah.
grass surfaces are not always well hydrated.
Yeah. And like volleyball, basketball, running, like these are all high impact activities. And when you're sort of loading the body like that, it's also creating a lot more pressure on the bladder and through the whole abdominal unit and the whole core. So what happens sometimes, if there's that lack of coordination or lack of strength or some dysfunction in the pelvic floor muscles, that pounding can actually create like a resulting leakage of urine. And so that's what stress incontinence is, and it's super common. It's super common that people think that it's normal, but it's not normal, right? There are 1 in 3 women or females or, you know, individuals with vaginas that will struggle with some sort of urinary leakage at some point in their life. Yeah.
And when I think of my ultimate frisbee team, I play on a women's team, and we're masters or grandmasters. We're all over the age of 30. And some people have had kids and some people haven't, and some is C-section and some not, right? There's like the regular variety of the population. And there are many of us who've said, like, can you just walk behind me just to make sure it's all good? Or I have to rush to the porta potty. To your point of like the stress incontinence piece, but also the ability to hold in pee, right? Like nervousness, especially before a big game for sure. But I can definitely think of some of my teammates who are like, oh, of course, she's gone to the bathroom again. And like part of me is like, I wonder if it's this combination of perhaps the stress, stress of the big game, but also the pelvic floor aspect of inability to hold in urine.
So it's that sort of impact, that loading and the stress on the bladder. And then what you're talking about there is like that urgency, like that, like you get this like urge to all of a sudden pee. It often happens if you're nervous, like before a game or before an exam or whatever it is. And you find yourself, you know, trying to find the closest bathroom, and you're like rushing to the bathroom and you're feeling this urgent need to pee. And some people will leak as a result of that too. So that's urge incontinence, but both of them can happen together too. And we call that mixed incontinence, right? You have that stress and that loading, but then you also have this urgency related incontinence. And, so yeah, those are probably the 2 most common types, I'd say.
I'll say, as I've been delving more into this world myself, from a naturopathic perspective, I've learned there's a variety of different vitamins as well that can play a role with some of these, particularly these urgency components. And interestingly, vitamin D is a big one. It turns out we have a lot of vitamin D receptors in some of those pelvic floor muscles. I can't remember which muscles exactly. I've probably written them down. They kind of lumped in my brain. I was like, pelvic floor muscles. But a lot of them have a high proportion of vitamin D receptors. And so we're actually seeing more pelvic floor dysfunction, again, that umbrella term, but more pelvic floor dysfunction in men and women, all genders, where there's a low vitamin D status. So vitamin D is always something I'm checking for in all of my patients, even the ones who play outside all the time. We think that we're exempt. Like, I'm outside, I get sunshine all the time. I was like, well, it turns out a bunch of us, I say that because I'm included, have some natural genetic mutations where we just don't produce vitamin D the same. I actually found myself,
that's good to know.
I actually found myself low in vitamin D despite being outside all the time as a summer athlete. But anyway, was able to assess that. Given as a naturopath, I could assess those things, run the blood tests, etc. And I guess I'll have to wait for this summer season for some big stress loading to see how rectifying my vitamin D has helped from the pelvic floor piece. But and I mean that's just one component, obviously.
That's great to know.
You and I chatted earlier as well about something again that to me is so mind blowing in this world, around this sense of like, you were calling it high and low tone. I was calling it like weakness or tightness. I don't know what the right words are there. Maybe you can enlighten us around the muscle tone. Like, tell me.
Yes. Okay. I'm gonna get my little model here. This is Penny, my pelvis. So these are all pelvic floor muscles here. and all the way back here. So the muscles go from our pubic bone all the way to our tailbone and on either side, okay? So if we look at the muscles inside here, this is our rectum back here, but all of the red that you see here, those are our pelvic floor muscles. So there are a lot of them in there, and it's a whole group. Some people refer to it as a hammock or a bowl of muscles that make up the bottom of our pelvis, right? So these muscles are just like any other muscle in our body. We have voluntary control over these muscles, so we can contract them, but we can also relax them, and we should be able to do both, right? That's where we start to get into problems. If you actually have difficulty with coordinating those muscles, some people are too tight all the time, or they're in a state of high tone or tension in their pelvic floor, and they have a really hard time relaxing and letting go of those muscles. But then other people can also be too lax and too weak and have difficulty with activation. So that's what I'm talking when we're talking about muscle tone in the pelvic floor. We're looking at a spectrum of tone, right? High tone on one side, low tone on the other side. And we don't really want to be on either end. We want to be in the middle. So normal tone is like that happy medium. But what I find interesting, especially with active women, and this is not, 100% exclusive to active women, but there are a lot of really active women out there that think that their pelvic floor is like really lax and weak. But in actual fact, when we assess these pelvic floors, a lot of them actually are too tight and they're too overactive. So these muscles, if you think of our shoulders, like oftentimes we'll be in front of a computer like this all day, and like you develop too much tension. That can happen in the pelvic floor too. So if you poke at some of those muscles internally, they can get really sore. Just like if you poke at tight muscles on your shoulders, the same thing can happen in the pelvic floor. So when muscles are too tight, that can then contribute to things like pain with penetration, right? Because if something is sort of poking in there and touching a really tight muscle, that can be uncomfortable. But also some of the muscles just even right at the entry then end up being too tight, and even the act of penetrating through the superficial muscles, that can be really uncomfortable too. So that's one thing, especially with high tone pelvic floor, is that we'll often see it correlating with pain with penetration or intercourse and pelvic pain symptoms. But the other thing too, when you're talking about high tone versus low tone, is some people, as athletes or as active individuals, we think, oh yeah, I want good tone, like really tight tone.
I want a six pack. I want to be like,
yeah. And the thing is, that's not balanced, right? So oftentimes when we think, yeah, my muscles are nice and tight and taut and strong, sometimes when people have high tone pelvic floor, and I get them to try and contract their pelvic floor, they actually present with weakness. Right? Because they can't access those muscles anymore. They're like in this shortened state of that muscle. So when I ask them to contract, it's like, there's nothing left there. And so in actual fact, it's not a strong functional pelvic floor. So that's why once these individuals can balance those muscles, then everything starts to get better. And some people, assume that if I have a tight pelvic floor, then I'm not going to leak. That's not true. Right? You can still leak if you have tension in that pelvic floor, because you don't have the ability to actually control and coordinate those muscles. You can still leak. And it's not until you're able to sort of contract and relax and coordinate those muscles in a really functional way that leakage improves and pain starts to improve. So
I have so many questions. So cool. So I'm just going to go back to the six pack. Like, yeah. And I know, and I've realized over the decades of being an active woman, like a six pack is just not in my genetics, whatever.
Yeah.
I'm not willing to put the effort. Like, there's lots of things I can say. I don't think it's healthy for women to have six packs, but that's another story. Mm-hmm. But like, when I went to see my pelvic floor specialist, my physiotherapist, mm-hmm. she did a lot of like ab work and was like, your abs are too tight. And part of me was like, well, I don't see a six pack, but like, I know that's a different story. But like, can you enlighten us a little bit more about how maybe some of those, I'll call them accessory muscles, how does that fit in?
Yeah, for sure. So when we look at the pelvic floor, we're actually looking not just at this unit. The pelvic floor and the core unit we think of it kind of like a canister. So the bottom of the canister is our pelvic floor. The top of our canister would be kind of like our diaphragm, right?
Okay.
And then and the canister is made up of essentially all of your ab muscles around, and then your muscles sort of supporting the spine. So that's what we call the canister. Just think of like a, I don't know, a Coke bottle or something, right? You got a top, you got a bottom, you got the whole round. So all of these muscles need to coordinate and need to function together. So sometimes what we'll see is if there's excessive tension in the ab muscles, that can also present with excessive tension in the pelvic floor, and even excessive tension in the diaphragm. So if we're not able to sort of have the ability to control activation and relaxation of this whole abdominal pelvic unit, that can influence all of the other muscles and functions in that canister. So yeah, sometimes people are gripping way too much through their abs, and that can also feed forward this tension in the pelvic floor. When we're gripping really, really hard in our abs too, we can't access our diaphragm as well. So then our breathing mechanics will change, and all of that can really then wreak havoc down to the pelvic floor.
As they take some nice calming breaths, or I'm trying to expand everything.
Yeah. It's crazy. It's tension, and think of like the other way I like to explain is think of a water balloon, right? If that balloon is like the whole intra-abdominal, like abdominal pelvic unit, and if there's excessive tension too much at the top, like say your upper abs are really, really tight and your diaphragm's really tight and it's causing gripping there, well, where's the pressure going to go? The pressure is going to come down lower, right? In that water balloon, if you squeeze that top of that balloon. Right, so that can be really influenced depending on where you're holding tension in that area.
Cool, thank you for the analogy. It made me think of a toothpaste tube, probably because that's what I was doing earlier this week, where you're like rolling the end and then it like squishes out, and you're like, it's too much toothpaste.
Right. And talking about stress incontinence, right? Like say we're squeezing at the top of our abs and our diaphragms is super tight. If we're squeezing up there, it's going to put more load on the bladder, and it's going to, just like that toothpaste tube, down below.
I hear you.
Is that good enough visual for you?
Definitely. It's social media appropriate. Perfect. It's so neat. Like I keep saying it blows my mind, because I've had, like I said, this week in particular, multiple patients say to me how pelvic floor work has changed their lives, and they're so excited to get to the root cause of these pieces. And to me, as a naturopathic doctor, it's just a wonderful complement to the other aspects that I can work with in terms of muscle and tension or how to relax. So there's lots of things on my end as well. But I guess I wanted to highlight this idea where it's like, whether you've been pregnant or not, or had children or whatever, like I just keep highlighting, like, yes, that's an aspect that can play a role with your pelvic floor health. But like I said, almost 30% of college-age women have pelvic floor issues, and I'm going to boldly suspect that 30% of college-age women, college sport, like varsity sport women, probably have not had children. So I just keep harping on that. It's not just for pregnant women, it's for all genders, whether you have a vagina or not.
And that's I'm an example of that too. Like I've not had children, but I've had my struggles with abdominal pain, pelvic floor tension, urgency issues, even constipation is associated with pelvic floor dysfunction. So, and that can be, some of the presentation in some of those active women, it may not be pain, it may not be leakage, but are you going to the bathroom all the time? Even though you're not leaking, are you going too much? Or are you having problems with bowel movements? If you're constipated, sometimes those muscles, if they're not letting go, and all of those functions can be affected too.
You and I are like sisters. What's the expression? Sisters from another mother or whatever.
I love collaborating with naturopaths. It's just so great. It's so hand in hand. Honestly.
And while I've got you here, I've got you, can I ask you some questions too about, so we've talked about like this incontinence piece, which to me, I picture a lot of like moisture aspects, but what about some of the other aspects? Like, what we're talking about down there? Like, especially when I'm looking at some of my perimenopausal women, or, you know, as an active woman playing with women who are in their 30s, 40s, and 50s, this is a topic that sometimes comes up, is that, oh, sometimes there's a bit of dryness, or maybe they won't use the word dryness, just kind of something like in discomfort or a bit of like chafing.
Yeah.
So proteins.
Yes, especially around that perimenopausal time. So for people that are not familiar with that term, it's sort of that lead up to menopause, and usually it starts 30s, like late 30s, early 40s. You know, very, very subtle changes in the way our bodies are functioning. But around that time and leading up to menopause, and usually the average age of menopause is around 51. So when we're talking about menopause, that's a full year without a period. Okay, so if somebody's gone through 4 months and all of a sudden gets a period again, not in menopause yet, but you're in perimenopause. But sort of in that perimenopause, even in the postmenopause stage of life, there are a lot of changes in our hormones, a lot of decline in our sex hormones, and that can influence a lot of our systems, a lot of the systems in our body, including our pelvic health. And one big thing that I hear a lot of is, active women coming into my office saying, I have a lot more dryness, itching, chafing. So whether that's vulvar dryness or vaginal dryness. So I'm going to show you another one of my friends here. This is Venus, the vulva. So the vulva is not the same as the vagina, right? So the vulva is the external genitalia. Vagina is inside, okay? So that's the canal, front between the vulva and going towards the cervix and uterus. But there can be a lot of dryness that occurs or that starts to cause problems for individuals, both vaginally and in the vulvar area. Now we're talking about active women specifically. I think one thing to note is, irritation. If there's dryness there can be irritation and chafing of that skin, which can be super uncomfortable, right? Especially if you're doing something repetitive like running and you just get all this rubbing happening, and that's not fun. But we'll also get a lot of irritation and chafing, especially for individuals that have a lot of leakage issues, and that skin then gets super irritated. It can also become, sort of red and dry and sore. So we want to sort of pay attention to that and try to manage that if possible. But there's also vaginal dryness that can occur, right? So vaginal dryness within the canal itself. And of course, with that, most people will discover it if they try to have any sort of penetration or intercourse. So unfortunately, it's just, it's part of what can happen as a result of the changes in our hormones and as we age. But there's some solutions as well.
On my end, I look at obviously like estrogen levels. Like when I'm looking hormonally, I'm looking at diagnostics, running blood tests to assess those pieces. And there's lots of things around food, around herbs, so like some of those nutritional supplements types things. So, but I always say to women, like, menopause is just like another highway. Like, you're on one highway between puberty and menopause, and then there's this other highway that you're gonna like merge onto. So it's gonna be great. You're gonna go fast and have a wonderful time on the other highway as well. But like the simple act of like getting off, like, using the off ramp, you have to change direction. You have to like slow down your speed. Like as a driver, there are things you have to do in order to safely navigate the inevitable off ramp onto the next highway. And my job, I say, as a naturopathic doctor, is to help you around those hormones, whether it be estrogen and female hormones, but also stress hormones, thyroid, etc., metabolism, these pieces, right, to make that off ramp like as smooth as possible. Like you're still gonna have to change direction and change gas speed. So there's gonna be stuff that's gonna happen. It's gonna be inevitable. But if we can make that a smooth ramp versus like a bumpy one with, I don't know, roadkill or whatever. So I like, can you tell me, like, I feel like coming back to you launched this online boutique as well. And you have this new product specifically for this type of thing, right?
Yes. So my pelvic health boutique, which is Pelvic Health Hub, which is platform that we're on right now. That's where I really offer my pelvic and sexual wellness products, but also online education courses for anybody out there that needs support. The program, that my signature program, is a program called Path to Pain-Free Intimacy. So it's for individuals that do struggle with painful intercourse or conditions like vaginismus or vulvodynia. And it just helps to support and educate women that struggle with these sorts of penetrative pain, and it's a program around that. But we also have education courses with regards to perinatal health, as well as like a core rehab, postnatal core rehab program as well. But most recently, I've launched a new product. It's called FemSense Balm. So this is a vulvar moisturizer. And this moisturizer relieves dryness. It's specifically for the vulva, derived from natural ingredients, no parabens, none of the yucky, negative chemically substances. But it really just is helpful to soothe, provide moisture, to provide a very light barrier, especially to, for that itching and chafing. And it's just another way to make, like you said, that path and that drive a little bit more smooth for people. Yeah.
Oh, so cool. And sorry, and I know we're on that platform right now, at Pelvic Health Hub.
Yes, Pelvic Health Hub.
Just making sure.
Yeah, so if you're interested, it is available. It's not available yet. It is going to be available as of April the 1st. But yeah, you can head over to the website, and if you want to learn more about the product and other products there, feel free to do so.
Oh, cool. And yeah, like your educational programs, like, yeah, I'm so excited about vaginas and vulvas and pelvic floors these days. Yeah. It just makes me rethink actually the program that I'm in the process of launching, which is all around exercise and nutrition related to our menstrual cycle. So I'm talking about estrogen and those hormones from a nutritional exercise perspective, so that people can feel more energized and not as depleted. And so part of me is like, I haven't covered some of these fun pelvic floor pieces, but that's okay. I can always segue and like send people your way.
Yeah, we'll have to talk more about that. I
go to masterclass in April for anyone who's interested to learn more in general about, it's called Cycle Boss, Cycle Badass, all about using your cycle around those pieces. So
love it.
Yeah, that's going to be like a piece, right? And like you said, like we complement each other so well in terms of our desires to help women feel awesome.
That's the goal, right? That's the goal.
So you made my Friday.
Likewise. Thanks so much for having me.
And I know that everyone watching can track you down kind of where we are now at Pelvic Health Hub. Pelvic Health Hub. And that's your online zone, and lots of fun stuff there. And I know that you and I will be chatting again
for sure.
in an official public way.
Definitely. But thanks so much for having me.
Thank
It was a lot of fun.
you. Have a wonderful weekend.
Yeah, you too. We'll chat soon, Andrea.
Bye.
Bye.